The hallmark symptoms of ADHD are inattention, hyperactivity, and impulsivity. But almost all kids are inattentive, hyperactive, or impulsive at some point of time or the other. So then how do you know whether your child or someone you love actually has ADHD? In order to have a diagnosis of ADHD, these symptoms have to be present to such an extent that they significantly affect your life or your child's life in two or more situations. For example, in school or at home or in the playground. Inattention in children with ADHD may look like they're not listening when they are being spoken to or like they're not following instructions at all. They may have trouble completing schoolwork or classwork or homework. Any of these may be difficult for them. They may have trouble getting organized. For example, getting ready for an outing or getting ready and packed for school may be really difficult for them. Children with ADHD get easily distracted and have trouble focusing. And yet there may be times when the kids are so focused on a particular activity or a task or a book that it's impossible to shift their attention from that task. This is called hyperfocus, and it's remarkably common in children and adults with ADHD. Hyperactivity in kids with ADHD may look like a child who's restless, fidgety, can't sit still, or in some instances has difficulty staying quiet in a situation where they're not supposed to talk. Impulsive behaviors may look like a child who finds it hard to wait for their turn in a game. This may also mean that kids with ADHD interrupt when other people are talking and don't wait for their turn to speak as well. As you can imagine, this makes it hard for children to get along with children with ADHD because they don't like kids who don't wait for their turn. ADHD is a childhood disorder. This means that most people will show the symptoms of ADHD before they're 12 years of age. But like all kids, kids with ADHD also change over time, and ADHD can persist until adulthood. Very often, we see a parent who gets diagnosed for the first time when their child is diagnosed with ADHD. Many times, adults with ADHD get diagnosed when their children get diagnosed with ADHD. This is because ADHD tends to run in families. If you have a parent with ADHD, it's much more likely that the child will have it too. We usually don't diagnose ADHD before 6 years of age because a lot of other things can masquerade as inattention, hyperactivity, and impulsivity when kids are really young. So usually it's diagnosed after the age of about 6, but some symptoms have to be present before the child is 12. Like all children, children with ADHD change over time. When they are younger, we might see symptoms of hyperactivity and impulsivity much more. But as they grow older, school-age kids and high school kids and adults show more of the symptoms of inattention. Children with ADHD have brains that are wired a little differently. Children with ADHD can't control their symptoms by just trying harder or just making an effort. It's not in their control, and therefore they're not to blame. The child with ADHD is neither lazy nor is giving you a hard time. In fact, they're having a hard time. Let's talk about school. Having ADHD can make school incredibly difficult for you. School requires attention, organizational skills, packing your bag, completing work, all of which is really difficult if you keep getting distracted and losing focus. Children with ADHD may have trouble getting organized, thinking ahead, and planning. In addition, many children with ADHD also have learning disabilities like dyslexia, which makes learning in school really hard for them. In the playground or in the lunchroom, since they have trouble waiting for their turn to speak or waiting for their turn in a game, it gets hard to get along with other kids in school. So this can make social life really difficult for children with ADHD. As for home, it can be really frustrating when a child with ADHD does not pick up after him or doesn't do his chores at home. So this can make relationships with family members like parents and siblings really challenging for them as well. When you speak to older children with ADHD and adults with ADHD, many of them see their ADHD as a gift. In fact, they don't believe that last D at all. They feel that their ADHD brings energy and passion into whatever they do. And if you remember, that area of hyperfocus that they have often makes them delve deep into whatever they are doing. So what do you do if you suspect that a child that you know or your child has ADHD? The first thing to do is to seek an expert in child development. This may be a different person based on where you live. And if you seek an expert in child development, remember that this is a clinical diagnosis. That means that there's no blood test or MRI that's going to diagnose the child. The diagnosis is based on listening carefully to your observations about the child, the teacher's observations, the child's own observations, as well as watching the child and speaking to the child. As you can imagine, it's hard to get to know your child well in the limited time that the professional spends with you and your child. And so it's really important for you to bring information to the professional who is going to rely on what you tell them, as well as what the teachers and the child themselves tell them about how their life is affected by the difficulties in attention and concentration. This may be in the form of questionnaires that the professional may send you beforehand. They may need to be filled out by you, the teachers, as well as the child themselves. Remember that it's really, really important to involve your child in this entire process. Tell your child that this evaluation is for the child and everybody around them to get to know them better, to support them in every way that is possible. Care for a child with ADHD and their family usually involves a team. At the center of the team is the child and their family. There may be a lead professional who is involved in medications or making important decisions along with the family. In some areas, this lead professional is a developmental pediatrician. A developmental pediatrician is a pediatrician who has expertise in child development and in working with children with disabilities. In some areas, this may be a psychiatrist or a child psychiatrist who may lead the discussion as well as the plan for management, and this person may also prescribe medications. The doctor who does the assessment will often be the same person who makes the diagnosis as well as prescribes a medication. The medication is meant to decrease the key symptoms of ADHD, that is, improve the inattention, hyperactivity, and impulsivity. It's really important to know that the physician who is taking care of your child needs to monitor your child's health. This means that they will ask you for your child's overall health history. Before prescribing the medication, they need to explain to you what the side effects are of the medication as well as the benefits of it. Every 3 to 6 months, the doctor may call you back to check your child's heart rate, blood pressure, height and weight to make sure that they are growing well and thriving. The other parts that are really going to help your child is firstly, you and your child really understanding your child's strengths and challenges and learning to work with them. The second part is how the community around the child, including your child's friends and your child's teachers, understanding and supporting your child. Once the initial assessment is done, there may be a bunch of other people, other professionals involved in helping your child and in helping the family. This may include, for example, a special educator and a psychologist who may assess your child for a learning disability. There may also be a psychologist or a counselor who helps the child with managing their emotions, understanding themselves better, and cope with issues that crop up in school like bullying. This same person may also help the family with understanding the child better and to support the child in doing activities of daily living at home, like getting their chores done or getting their bag packed or getting their homework done. Some families may have a social worker involved in the child's care. This is because a social worker can be really helpful with respect to getting a disability certificate, which in turn will help the child get concessions in school for exams, etc. It may seem like a lot to coordinate initially, but once the child has understood their own strengths and challenges and learned how to manage their ADHD, and the family and the school has learned how to support the child, your child with ADHD can definitely learn well. They can make friends at school and outside school, and they can have successful relationships with family members as well as teachers. Every child with ADHD has the capacity to grow into a happy and successful adult. If you found this video helpful, do like and subscribe to this channel.